Katie was an amazing young woman with an incredible smile. She lit up the room when she came in.
Kathy McInnes struggles with the loss every day.
You know, you never think it's the last.
Of her 28-year-old daughter, Katie Buckle, who for years openly battled alcohol addiction.
It's a horrible, cruel disease. It's so misunderstood.
Buckle was in and out of treatment.
You're just constantly on a treadmill trying to grasp for any kind of help you can get.
And in February 2020, she joined a rally calling for change outside the state capitol.
That's the part I loved about her, is that she wanted the help.
Soon after, with no available beds in Oregon, her mother says, she left for treatment. 2 days later, heart disease caused by long-term alcohol use claimed her life.
Why? Why did I have to send her to Southern California? Why?
Oh, she's far from the only one wondering.
It's very disheartening.
And here are the cold, hard numbers. According to federal data, Oregon now ranks worst in the country when it comes to the percent of the population suffering from any kind of illegal drug addiction. Add in legal substances like alcohol, and we're still second worst. And there's another strand to this story: treatment. When it comes to those who are seeking but can't access treatment, out of all 50 states, Oregon ranks dead last.
Something's wrong with that, in my opinion. It means we don't care about people's lives.
It's depressing because it's unnecessary.
And Mike Marshall with advocacy group Oregon Recovers, himself in recovery, says while the pandemic hasn't helped, the root cause is political inaction.
It's not rocket science. We can do this. It's just a matter of will.
The biggest challenge is access.
At the Hazelden Betty Ford Foundation in Newburgh, Executive Director Heidi Wallace points out, while they have enough beds, big picture, Oregon's system is essentially broken.
I mean, we say it all the time, hope is not a strategy. I can't have hope and have that be the only thing. You have to actually have a plan that you take action on.
Though the state has had a strategic plan, we learn, 89 pages worth, for nearly 2 years.
Do you think it's a priority?
If it was a priority, we wouldn't be number at the very bottom of the list.
The plan, I think, has been on the back burner.
And Jill Gray should know. After all, she's senior policy advisor for the Alcohol and Drug Policy Commission, the independent state agency that created it.
COVID's always going to be here, but that can't be our continuing excuse not to make progress.
With a law now in the works, she says, to compel more than a dozen state agencies to get efforts moving.
Why does it take a bill to get everybody on the same page to meet with you guys?
Yeah, I think part of it is just the force that a piece of legislation has.
I will continue to partner with the legislature.
The governor's office says expanding access to prevention and treatment are among her top priorities and points to new investments this year and last to help support and retain behavioral health staff. Funding from voter passed Measure 110 about to go to counties to reduce barriers to treatment, plus $200,000 to help the commission get started, though they've asked for over $100 million.
There simply have to be more treatment beds.
Essentially a work in progress, the commission says, that's left this mother still mourning and on a mission.
I'm going to carry this mission till the day I die. There needs to be some action taken. We need to have some action taken.
David Mulco, KGW News, Portland.